Hey everyone, it's Dr. K. So a lot of runners seek the advice of healthcare professionals in choosing their footwear, because they're looking for recommendations to reduce the risk of injury. Now, most of the opinions out there on selecting footwear are not, 100% scientifically supported, and a lot of the research that's done on running footwear design really hasn't been highly accessible to people. So it's hard to, reach a good, scientifically supported opinion. So there are three aspects in footwear design that you should take into consideration, be made aware of. The first one is comfort level, second one is force modification, and the last is motion control. So without a clear indication of any kind of global injury risk factors, the best practice is really just understanding how footwear influences running mechanics and musculoskeletal overload, and how these things can impact you as an athlete while you're training. Now, shoes with a thicker midsole can provide more cushioning, which is beneficial because, as a runner, if you're training long distances, you want to be very comfortable. The problem with the increased thickness, though, also, means that it's increasing the distance between the foot and the ground, and that increases risk for things like ankle sprains. Now, runners who are rear foot strikers and they lack, either muscle or strength or ankle stability, are more susceptible to ankle sprains. And if you've had an old ankle sprain or old ankle surgery for an ankle sprain in the past, like myself, then your ankle is going to be more at risk for repeated ankle sprain injuries in the future. And so that may be a factor for you and your consideration when buying your shoes. This may also lead to a longer stride length, which increases the load through the hip muscles, which if you have poor hip strength or hip motor control, that can be a leading factor for hip pain. And I don't know one, runner who wants to develop hip pain. So force modification is done on the body through things like minimalist footwear, but that actually increases the strain on the posterior musculature because of the shift towards like a forefoot stride. It also increases the step rate. So minimalist shoes are meant to, protect your feet while you're, in theory, you're running more naturally, just like you are when you're barefoot running. But that may be inappropriate for runners with any sort of acute posterior chain muscle strains, or, that may lead to tendinitis down the road from overuse injuries and that increased stride rate. The problem with these shoes too is even though they're supposed to increase a forefoot strike pattern, that's going to help eliminate impact forces on the ground, minimalist shoes don't always lead to shifts in a change in your strike pattern. And so rear foot strikers, who don't make that transition, actually demonstrate higher, ground reaction forces, which means it's higher loading times and higher stress on the body compared to traditional shoes. So even if you do transition into a forefoot running form, there's some research out there that says that, it still negates any kind of vertical ground reaction forces in the shoes compared to conventional shoes. So it says that they're basically the same. Now, lastly, if you're looking at your shoe and your midsole and how it influences the motion control and the mechanical work at the ankle, then, you should consider this. Runners with acute Achilles tendinitis may benefit from reducing, any ankle mechanical work with consistent use of this type of midsole. But if you do this consistently, it actually degrades the Achilles tendon stiffness. And the stiffness in the Achilles is actually what you want for the plyometric component of running. You want a nice springy step. So if you have less stiffness, what it does is it effectively lowers your ability to withstand the stress, and it increases the chance of strain in the future. So if you're performing multi-sport or multi-event running, you may be at risk for injury. You may want to consider that. So runners susceptible to things like Achilles tendinopathy may benefit from maybe switching shoes and running with shoes with that type of midsole for race day events only, but actually training with a shoe with a different foam that's a little bit more giving during training so that we maintain that stiffness and the mechanical work and power that we want at the ankle. So we hope this gives a little bit of perspective to the information when choosing your new shoes. Let us know if you have any questions. stay strong, inspire others.